I am delighted to be here today. We have a panel later today that will be very exciting. By the way, people standing in back, there's still some seats in front if you want to move up here. I'm delighted today to introduce Secretary Mark Ghaly from California. It was my pleasure to meet him through Governor Newsom, who has been on this journey of starting our dyslexia center at UCSF. Because he's a dyslexic learner, and through him I was introduced to Secretary Ghaly. And I guess I'll just say two things about him. First of all, my research shows that he runs about a $220 billion budget, which is actually larger than any other state budget in the country other than California. So you can imagine the vast enterprise that he has to run. It's almost, unfathomable. And yet he's chosen to be here today and share his words with us, which I appreciate, and talk particularly about, I think he'll talk about the mental health modernization plan that we've been working together on. And I guess on a more human level, what I've learned last night is that while he's an administrator over this massive system, he's actually, oddly, one of the few practicing doctors who's actually ever held this position, and he has the lived experience of having actually delivered services to a lot of the underserved populations that we all try to serve and that we care about, and that makes him uniquely human and I think highly impactful, and that makes him a kindred spirit with all of us. So with that, I introduce you to Secretary Mark Ghaly.
Good morning. Really pleasure to be here. It's a true honor on behalf of Governor Newsom, who couldn't be here himself. I'm proud to represent California. I see a number of Californians that I know and probably others that I don't know who made the trip here to continue the brain jokes. Hopefully we didn't leave our brains back home. We brought them with us to really share some of the great transformation that we're experiencing in California. Okay, better? I think so. So just want to spend a few minutes talking about the unique position California is in, both as a leader in so many ways, whether it's in science or the application of technology, but also the challenge that we have in that our safety net has frankly had holes in it for decades. And Californians have slipped through those holes for a very long time. And in some sad ways and literal ways, we have many of them who are landing on our streets. And behavioral health conditions are one of the primary concerns and drivers there. And so Governor Newsom, recognizing both the reality as a mayor of San Francisco, lieutenant governor next, really came into office with the hope of really transforming the behavioral health system. And in my brief interview with him for the role that I now have, we spent 80% of our time talking about behavioral health. And so this transformation and what I'm going to share with you punctuated in some recent activities and actions, but really dates back many, many years ago to the vision he's had. So reality is we were and still are at a breaking point in California, and I would say across the nation. The pandemic raised, unmasked so many of the inequities, the challenges in our system. What I learned in medical school, the term structural violence, the fact that we have structures that are not kind to people, especially low-income people, people of color, people who don't always have the same opportunity as others. And then the racial reckoning. I still remember the day in the town I grew up in Minneapolis, the George Floyd murder, and what that meant to the entire nation, riveting all the way to California immediately, and the questions that come up about what systems do we actually have in place in this pandemic challenge with racial reckoning. And racial reckoning really the beginning of a whole conversation about inequity again. And through the pandemic, this anchor, and I really appreciated the notion that this concept is really anchored in equity. We've led with equity in so many of the ways we think about our policies, because if we can't do for all boats lifting up some more than others, then much of our policy is not going to deliver on the promises that we think of in California as a California for all. So how did we get there? Decades ago, then Governor Ronald Reagan made some decisions with a legislature to close down so many of the institutions. They were horrific institutions. There is no doubt that those were not the institutions we wanted today. But the other part of that promise in closing those institutions was this beautiful idea of a community-based system, and it never materialized. We did not make the investments that are needed. In another slide, in a moment, you'll see the word fragmented and under-resourced. To me, those are code words in policy and politics of under-prioritized, and this was not something that we prioritized. We didn't have the infrastructure, and frankly, I've lived through decades of inattention on how do we address mental health issues and substance misuse, which I appreciated the words of Governor Inslee and the notion of what fentanyl means. This is not the last challenge that we're going to see. It's getting more sophisticated every single day. So the science of addiction, the science of brain health is paramount to us addressing these needs. So again, fragmented, inadequately scaled, code words for under-prioritized, and we have in California a real challenge because we don't have the access to the services that I think are really going to change the arc of the lives of so many Californians who desperately need them. We often talk about, in the agency I have the privilege of running with a couple of colleagues in this room, how we are worried about and are responsible for low-income Californians. About 1/3 of our population is on the federal Medicaid program. It's sort of a moving target at the moment, but 1/3 of Californians depend on the services that we at the state fund. Billions and billions of dollars, my $220-odd billion budget, about 40% of that is all Medicaid. So a huge program. But then what about the other 2/3? We know that, frankly speaking, the health systems of many years old have not invested, have not reimbursed, have not paid for the innovations and the models of care when it comes to behavioral health in the way that we really need to have happen. So some of the reform that we're focused on, I'll get to it in a minute, is not just how do we improve the Medicaid system, but how do we make sure that we support the commercial healthcare system as well. So this is a slide that represents about 3 years of work, maybe a little bit more, but really is the punchline to Governor Newsom's vision over, frankly, decades of leadership in politics and government. This is a $20 billion investment. California has had opportunities over the last few years to make investments in a number of things. Governor's interest in behavioral health has really anchored that as probably the key place, along with climate change interventions. This slide captures that. Autumn and Melissa here with me today, they lead this children and youth behavioral health initiative that is really targeted at looking at kids 0 to 26 and addressing all of their behavioral health needs, regardless of what sort of payer is covering your health coverage, using technology. Kuth was mentioned, helping us create a platform to allow every child in California, 0 to 26, not just children but young adults, to access care, and a number of different workforce transformations, working with the clinical community, the education community, addressing a number of different needs with a $4.7 billion investment. I think many people in California say, oh, that's just a one-time investment, but out of this is coming some other things that are going to last much longer. Roughly $500 million of ongoing investment year over year to make sure that these services are supported. The Medicaid transformation is probably our big one. Many of you probably know in the United States we have a chance to apply with the federal government for waivers to change how we deliver Medicaid approaches in our states. Governor Inslee's team is a leader as well in really pushing the envelope on trying to transform their Medicaid system in ways that really change the rules of the road, if you will. And we did that through our Medicaid transformation, allowing the integration of physical health and brain health in a way that we've never seen before, increasing the payment the processes by which people are eligible for service. So this $10 billion transformation is focused on both physical health and mental health, but it also addresses some of the very key social drivers of health. So housing insecurity, food insecurity, transportation issues, other supports never before really paid for as a supportive service, but I'm sure in today's conversation you see the deep connection in those social drivers of health around brain capital and building up mental wealth. Workforce, a huge issue in California, I think across the nation. We're missing not just our traditional workforce, whether that's social workers, psychiatrists, nurses, other clinical staff, but we're actually missing the innovative classifications of who can do this sort of work for us. We've depended on traditional educational pathways to train our behavioral health workforce for the future, but we haven't done enough, spent enough time innovating on what sorts of professions we actually need for a modern day behavioral health system to actually work. That $1 billion investment is just the start. And then a number of other investments around building up our infrastructure. That infrastructure that was never built in the 1960s and the decades after. Governor Newsom is taking a big step forward to build that up today. So Steve shared a little bit about something that if I were here a week ago, I couldn't share with the degree of confidence I can today, because our legislature in California last week decided to pass this both in the Senate and the Assembly in pretty unanimous fashion. The concept here is 20 years ago, California put on the ballot, and some of you are much better equipped to talk about this than I am. I wasn't there 20 years ago. Some of you were. We put on the ballot, and the voters approved a tax on earners over $1 million to fund mental health. And those dollars were critical. I like to call it the grout of the system. You know, you have two tiles over here. How do you link them? You put some grout between them. This funding source has been the grout for a very, very long time. But in 2 decades, things have changed, and the transformation around this voter advanced initiative was required. So the legislature, through the governor's leadership and a number of people around him, put forward this concept that will go to the ballot in March to transform the Mental Health Services Act, which when it started, it was about $600–700 million a year. Today, it can be on an annual basis more than $4 billion a year. So a huge ongoing source of funding to support the behavioral health system, and you'll see in a moment, to innovate it and push it forward. It comes along with, this transformation comes along with a large general obligation bond, typical bond in government fashion, but the approach is going to be to build up 10,000 places for people to receive care or be housed. Some of those are treatment-focused settings in cottage-style or campus-style environments, or your traditional housing, which California desperately lacks, and housing that's available for those who are suffering with the greatest degree of behavioral health condition we need. So hope to build 10,000 new long-term placements there. The Behavioral Health Services Act did a few key transformations. First, of that roughly $4 billion, we're telling counties that you need to spend some of it on housing those who are experiencing homelessness with severe behavioral health conditions. As somebody who had the privilege of taking care of plenty of people experiencing homelessness in Los Angeles County and before that in San Francisco County, I know firsthand that the service that many need the most is a place to live. It's hard to stabilize, destabilize schizophrenia and psychotic disorders under a bridge or in a tent. So how are we going to build the approaches with ongoing funding to be able to do that? So 30% of that roughly $4 billion a year dedicated at the county level, and we have 58 counties, a lot to corral and coordinate, but each one is now going to be required to spend roughly in total $1.2 billion a year on supporting the housing needs. Second, when the first Mental Health Services Act passed, there was a clear and deliberate leaving out of substance use disorders. Understood 20 years ago, the stigma around substance use disorders was a very different place than it is today. Governor Inslee's reflection on fentanyl, just the tip of the iceberg, so many other important substances being abused and used in California and across the nation. To disqualify that from a use of these dollars in today's concept would be inhumane. So now we've included it in this modernization. And the third area, which I really appreciate the presentation on the dashboard and the need to come up with a holistic way to look at what we're actually getting for these dollars. We've never done that in California. This has been money that went to counties, spent in pretty blind ways. We weren't able to understand what we were getting. Small projects here or there. The Mental Health Oversight Commission could get some of that information, but not in a holistic way. And so through this modernization effort, we're going to be able to actually county by county understand, based on some statewide outcomes, for example, how many people with severe behavioral health conditions are incarcerated, how many are living on the street, how many young people are system involved, either in the juvenile detention system or in our child welfare system, trying to understand that data so we aren't just expecting things out of counties, but we're inspecting what they're doing and hopefully pushing them to be better and to do more for more people. And then we are always been proud about the focus on prevention and early intervention. The truth is we've coupled those together for decades, prevention and early intervention, yet they are quite different approaches. Early intervention, identifying specific needs of people or small groups. Prevention, we think about on a population-based level. So really unwinding those a bit, not to diminish either, but to lift up the importance of prevention as a set of activities that we need to invest in more, be more thoughtful, more upstream in many ways. Then the last piece, which gets to this notion that what we're doing is in the public safety net system, but 2/3 of our population get their support around behavioral health in the commercial healthcare system, which has been arguably the Wild West, very low expectations, the concept of parity. I liked Toby, your concept that parity is a complex concept, which is also a way to say we haven't figured out how to apply parity in the commercial system in a way. So we are certainly focused on how do we push our commercial plans to do a heck of a lot more for Californians than they do today. In a world of healthcare inaffordability, one of the key drivers of economic troubles due to healthcare in California are out-of-pocket expenses for behavioral health, and that has accelerated in the pandemic. So I often called COVID-19 the greatest accelerant for change, also the greatest unmasker of inequities in our state of California. And in many ways, we are using COVID-19 and the work that has emerged to really push us forward on behavioral health in a way that I don't think we would have otherwise been able to push. So you have a governor who is deeply committed to this, and then you have a horrific, terrible, difficult event in the COVID-19 pandemic that I think is going to be the beginning of a really different story for behavioral health in California. I want to just wrap up in a little bit where I started. California is an interesting place because we are known in so many ways, not just in the United States, but across the globe for innovation. A lot of amazing academic institutions, strong public universities, researchers with, I think as the governor says, more Nobel laureates than any other state and frankly most other countries, and a great deal of promise on the one hand, but then on the other hand, really struggling with the reality of that structural challenge that we have where people who are, by virtue of their race, gender, sexual orientation, language they speak, or ethnicity, aren't getting the kind of care and opportunity that we would hope. So how do you balance these? And I think about the need for us not just to think about innovation, but to think about invention as well. And those as two very different concepts. Innovation, in my mind, is where we take something that we know and can do and scale it in a way. And I often say innovation in the safety net is scaling something to California's size. So we are busy doing that for sure, and those investments promote it. But today's conversation, I think, is about how does California continue its history of being inventive, and how do we push our partnerships through those deep commitments and investments in partnership with many of you to think about not just brain capital. We talk a little bit about relational wealth too, and how important relational wealth is, but this different notion of how do we look at the wealth of our population, whether it's on relationships or mental health or wellness. How do we look at the built environment? How do we look at the investments that we make in California's safety net as something that can spur that forward, and as part of that mental health behavioral health services transformation? The governor has said $20 million a year dedicated to looking for opportunities to push innovation within California. But innovation in a way that isn't just private sector looking at the next opportunity, especially from a fiscal or financial lens, but how do we take those new inventions and really get them immediately embedded into the safety net programs? And so I know this is sort of a tough nut to crack. I meet with a lot of people who have the new next greatest idea, but have no idea how to navigate the California government or the federal government to have that become something that is continued. We want to, in California, find a way to take the best ideas, the greatest ideas, and integrate them not just in the out-of-pocket opportunities or the commercial opportunities, but within our safety net. Because if we really believe in equity, it's how do we bring the latest, greatest transformations in a culturally competent, smart way into our safety net programs. And if we can take years off what is usually a decades-long journey, we think we can change the course and arc of many Californians' lives. So it's exciting to be part of this. I'm really excited about the team we have here, the number of Californians who are thinking about this, and frankly, the opportunities to transform a large system in the United States that I hope many of you and many other states can learn from in the years to come. So thank you for your time.